Hi, it's Casey. Okay, some indications for suctioning is to remove visible secretions. If the patient's in acute respiratory distress, if I need to obtain a sputum specimen, and if the patient is not able to generate an effective spontaneous cough. If I see any of these indications, I'm going to obtain the equipment needed if it's not already in the room, and that'd be a closed suction catheter, a vacuum connecting tube, vacuum regulator, collecting tubing, collection jar, and then the overfill safety trap. If I haven't done so already, I'm going to review the patient's chart, and I want to know how they react to suctioning. And then I will come in and say, "Hi, Mr. Jones. My name is Casey. I'm an RT, respiratory therapy student, and I'm here to get some of those secretions out, and it's going to make you cough, but you're going to feel a lot better afterwards." At this point, I'm going to wash my hands and put on non-sterile gloves. I'll put the patient in the semi-Fowler position. Then I'm going to make sure that I test my connection tubing, and I'll do that by placing my thumb over the tubing, and I want that to be a -100 to a -150 millimeters of mercury. Since I am not a seasoned therapist, I will not know exactly what that will feel like, so I'll hand that over to my clinical instructor and make sure that it is correct. I will, at this point, monitor the patient. I will want to know their blood pressure, their heart rate, their heart rhythm, their respiratory rate, their ICP, SpO2, and I'll glance over and see the color of their sputum. I will unlock the port, and I will take off the lid. I will hyperoxygenate the patient for at least 30 seconds, and I want their SpO2 to be 99 to 100%. If the patient has thick secretions, and I know this, then I will lavage them, and that's where I will add in the 5 to 10 milliliters of saline, and I'll put small amounts during inhalation. Then I will remind the patient that this is going to make them cough forcefully, but it's going to be okay, and they're going to feel better after I'm done. So, at this point, I'm going to start. I'm going to go in. I'm going to go all the way to the carina. Once I hit the carina, I will back up a centimeter and press the button and intermittently vacuum as I am turning the suctioning all the way out of the patient. Like so. And I want that to last no longer than 10 to 15 seconds. After I do that, while I'm doing that, I'm going to be monitoring the patient's their vitals. I'll be looking at their SpO2 and all their blood pressure, respiratory rate, heart rate, and making sure that they're reacting well to the suctioning. After that, I will check all the vitals again and see the color of the sputum that comes out, and immediately after, I'll hyperoxygenate them for at least 1 minute. I will listen to them bilaterally and see if any of the sounds in the lungs have cleared and if I need to do suctioning again. I will then lock the port like so, and then I will I'll chart it, and I'll tell the RN that I have suctioned the patient, and I will tell her about the amount and color of the sputum and the tolerance of the procedure. And that is it.